I'm Deb Fisher, and I'm from Cleveland, Ohio. I grew up playing outside every day during the summer. We camped all summer, swam, always in the sun. I actually was a tan bed fanatic. During my high school years, I would go multiple times a week. We didn't know anything about melanoma when we were that age. We just knew that it was an old person's disease. We never thought that it was anything that would affect younger people. I was at my dermatologist for something else, and I had just asked him to remove a mole. It was bothering me, and it looked normal. And he took it off, and 2 days later, it was an incidental finding that it was malignant melanoma. He said that I was his youngest patient at the age of 21. I honestly didn't know a whole lot about malignant melanoma, and so therefore I was terrified. I had gone to a few other dermatologists, and once they learned at the age of 21 I had malignant melanoma, I felt like my body was a free-for-all for them to just remove moles. What led after that was multiple biopsies, multiple skin infections from the biopsies, multiple issues with sutures and keloids. Early detection was truly the key to my survival. Everybody should have a skin exam annually. Most of the dermatologists that I know use a dermatoscope, the little handheld light. At the facility where I work, we're also incorporating MELAFind for patients who do have malignant melanoma, familial history of it, or atypical mole syndrome. The physicians have explained it to me as a patient that it's just another tool that they can use to help figure out whether or not they want to remove a mole or not. So when I went to see the dermatologist this year, I had MELAFind done, and they scanned probably 7 or 8 moles. That, for me, was the best thing, walking out of the dermatologist's office for once in my life and not having to have something removed. I would recommend it from my personal standpoint and from what we have actually seen in the clinical use of it, as far as creating this atmosphere for the patients that is much more calming and educating, and they know when they leave what that mole actually is in their eyes. It really takes a lot of pressure off of them, believe it or not. I absolutely talk to the patients from my perspective, being a survivor of malignant melanoma. I can actually put their mind at ease and share my story with them and help them understand why the technology is so important to them and why it would benefit them. MELAFind provides us data that lets us determine whether or not we need to remove it, or we can just observe it until their 3-month, 6-month annual checkup. I wish that this technology was around 20-some years ago.